In this video, we are going to be talking about cervical spondylosis and its treatment. Cervical spondylosis refers to spondylosis which affects the cervical spine. And when we talk about spondylosis, it comprises of two words, spondylo as well as osis. Spondylo refers to the vertebrae and osis refers to degeneration. So spondylosis is a process of degeneration of the vertebrae, and when it occurs in the cervical region of the vertebrae, it is called as cervical spondylosis. Generally, cervical spondylosis is a problem of aging. It is associated with degeneration of these structures associated with the vertebrae and the other associated structures. So cervical spondylosis typically used to be a disease that used to occur during the old age in the earlier times. However, in the current day, we are able to see a number of patients who suffer from cervical spondylosis at a much earlier date. If you look at the reasons as to why this is happening, one of the major causes is that by design, the cervical vertebrae is prone to, it has got very thin sort of intervertebral discs. And human beings are designed only to be walking on the feet. We are sitting in a vehicle and traveling over extended distances where the body is subjected to jerk as well. Even in the normal course, with the passage of aging, with the passage of time, the water content in the intervertebral disc starts getting reduced, and that leads to a process called as dehydration. This dehydration of the disc makes it prone to degeneration. Wear and tear is more affected in those discs which are already dehydrated. So when a disc gets dehydrated with age or due to lack of physical activity and so on, in that sort of a situation, when there is a vertical compression that comes on the intervertebral disc, the disc then gets into other complications like a tear. There are several types of tears called radial tears, annular tears, as well as concentric tears. There are vertical tears. So there are several methods, like it can be torn circumferentially or it can be a direct tear where there is an internal nucleus pulposus, which is a very soft jelly-like structure, which is covered by the external fibrous tissue called as annulus fibrosus. When the external tissue is subjected to a vertical jerk, it cracks, allowing the internal nucleus pulposus to protrude out, and that condition is called as a disc prolapse or a disc bulge. Depending on the extent to which this is prolapsed outward, it can compress on the structures that are present very close to that, especially the spinal cord and the nerves that are emerging from the spinal cord at every level in the cervical vertebrae. When the bulge is centrally located, that is, it is directly in the middle of the vertebra that the bulge is taking place, it tends to go and compress on the spinal cord, which will not lead to symptoms in the arms, but will lead to symptoms that are lower down. They compress the nerves that emerge through the lower roots, that is through the lumbar area and so on, and that causes the condition called as cervical myelopathy. Whereas if they are pressing on the side, if the bulge is to the lateral side or to the side of the vertebra, they compress on the nerve roots that are emerging from the cervical vertebrae and supplying parts of the shoulder, hands and so on. They may be of sensory nerves or the motor nerves, which leads to altered sensation, pain, etc., affecting the different parts they are supplying. Based on the location of the bulge, the symptoms are manifested in those locations, and that condition is called as cervical radiculopathy. See, this is one aspect of the cervical spondylosis which is due to the disc. The other structures that are associated with the cervical vertebrae can also be responsible for cervical spondylotic changes. There can be osteoarthrosis of the joints between the two vertebrae. At the facet joint, as it is called, the facet joint is the one that permits the two vertebrae to articulate against each other. These joints are like the other joints in the body and can be subjected to wear and tear due to old age. They can also undergo degeneration due to inflammatory processes like rheumatoid arthritis and so on, which affects those joints. And over a period of time with aging, the facet joints also undergo osteoarthritis and they also become swollen, and that osteoarthritis can also be a cause of compression on the nerves that are emerging. So these are, then the other aspect that happens is with respect to the ligaments. The ligaments that hold the vertebrae in position and allow for the proper movement and control of the movement of the cervical discs also undergo hypertrophy or thickening with age, and that can also cause pressure on the spinal cord or on the nerve roots that are emerging from the spinal cord, leading to the symptoms that are associated with cervical spondylosis. So when we understand the word cervical spondylosis, we have to take into consideration these several structures like the intervertebral disc, the ligaments, the bones, the facet joints, and so on and so forth, which together create a conducive atmosphere for the cervical vertebrae to move against each other, as well as for the spinal cord and the nerve roots to function without any problem. Whereas when the cervical spondylosis takes place, this particular alignment is missed, and that leads to manifestation of symptoms associated with cervical spondylosis. If you look at those symptoms, primarily cervical spondylosis manifests as pain in the neck. If the upper level of cervical vertebrae like the C2, C3 and so on are compressed, it leads to pain that is in the occipital region or the back of the head, headache that can be caused by it. It can also lead to giddiness and so on. Whereas in the lower vertebrae, that is starting from the C4, C5 and so on, if those vertebrae are involved, it leads to symptoms radiating to the shoulder, to the arms, to the forearms, the hands. And symptoms range from pain, it can also be altered sensation, numbness and so on. Some patients also suffer from weakness of the hands, they are not able to move the fingers properly. So it can result in pain, numbness, altered sensation, weakness and so on in the areas supplied by the respective nerves that are affected by the compression, either due to the ligament or due to the intervertebral disc or the facet joints. So these conditions result in cervical spondylosis. Now when we look at what can be done about it, conventionally one of the most important things is to prevent this from happening, and for that one of the most important things is to have a regular activity. Maintaining a proper posture during work and at leisure. Another very important thing is also to remain adequately hydrated. Chronic dehydration leads to faster dehydration of the intervertebral disc as well. So the fluid balance in the body has to be maintained properly. A proper exercise routine which keeps the muscles of the neck strong and flexible is very critical also to prevent cervical spondylosis. But once cervical spondylosis occurs, it is generally, in many cases, it is self-limiting and it automatically corrects itself. With some exercises and rest interspersed, many patients get rid of a transient neck pain that occurs. Whereas if it is of a chronic nature, cervical spondylosis can become a very big nuisance and can lead to very severe loss of quality of life. In this scenario, modern medicine advocates the use of painkillers as well as physiotherapy as a remedy to these problems. Whereas in the Ayurvedic school, we have some Ayurvedic medicines made out of herbs which are very effective in relieving these symptoms like pain, numbness and so on and so forth, again improving the quality of life to normalcy. If there is an even more severe sort of a manifestation in modern medicine which does not respond to painkillers and physiotherapy, modern medicine recommends the use of surgery. It can also start with epidural injections or surgical interventions to relieve the pressure on the nerves and thereby enabling the nerve to get back to the normal functioning without pain and so on and so forth. Whereas Ayurvedic approach to treating cervical spondylosis, which is of a very chronic nature, involves the use of certain therapeutic procedures that we do. We apply certain oils, medicated oils, there are certain herbal powders which are used as poultice. We also give some oil soaking on the neck called Grivavasti. We also do certain bandages which help to strengthen the muscles as well as to heal the nerves. The most important difference that happens with the Ayurvedic treatment for a chronic cervical spondylosis is that the Ayurvedic treatment helps to heal the nerves that are compressed and which get into damage due to chronic cervical spondylosis, leading to a long-term resolution of the symptoms like pain, numbness, weakness of the arms, inability to use the arms, contracture in the fingers and so on and so forth, which can result from very chronic cervical spondylosis. So this is the difference that we do in Ayurveda, and we at AVN Arogya are really specialized in the treatment of problems related to cervical spondylosis. We have certain proprietary preparations which are very effective in the treatment of Ayurvedic in cervical spondylosis, And we have also mastered the art of treatment of cervical spondylosis through the Ayurvedic procedures. Unlike most Ayurvedic treatments which take a very long time, our experience says that we are able to treat most patients with cervical spondylosis between 7 to 8 days of time. People are able to get back to normal. Unless it's a very severe condition where we may take about 10 days to 12 days at the most to give inpatient therapy for even the most severe cases of cervical spondylosis to get back into their good quality of life.